Good morning. I want to begin by thanking all of you for joining me for today's education community briefing on coronavirus COVID-19, and for doing so on such short notice when you're balancing so many significant and competing interests in your community. I'm Secretary of Education, Pedro Rivera, and I'm joined today by our agency partners, Andy Pickett from the Pennsylvania Department of Health and Tim Sevison from the Pennsylvania Emergency Management Agency. I also want to take a moment to characterize the participation of the education community on this morning's webinar. We have over 1,000 education leaders joining the forum, including intermediate unit leadership, school district leaders, building principals, school board members, leaders from our statewide education labor unions, and more. I appreciate the leadership of the statewide education organizations in helping plan this morning's session and in ensuring broad and diverse participation. Our agenda for this morning's webinar is as follows. First, we're going to provide a high-level briefing on coronavirus COVID-19. As education leaders, you're used to wearing a lot of hats: organizational leader, instructional coach, community leader, and child advocate. But for the past roughly 2 weeks, you've been asked to serve as an expert communicator around one of the most challenging public health issues of our lifetime. But communication continues to be of utmost importance. On behalf of the entire administration, I want to thank you for your extraordinary effort to communicate what coronavirus COVID-19 might mean for your education community, support and reassuring your stakeholders, and for planning rapidly evolving context. Still, we want to spend the first few minutes of the webinar providing additional context around coronavirus COVID-19 to ensure that education community leadership have the same information in the same language directly from the state's chief public health experts. Next, we'll outline PDE's planning to date, including efforts to support the field, examine our options to provide flexibility as circumstances warrant, and to advocate for relief at the federal level. These efforts take on special urgency in light of the governor's direction yesterday and the implementation of social distancing in the Montgomery County. Guidance that is obviously and necessarily impacting neighboring communities. Here, I want to acknowledge how extraordinary the past week has been for many of you. In a local control state, where the business of the state education agency is fundamentally about setting conditions for your work rather than dictating it. Again, let me reiterate, the role of the Pennsylvania Department of Education is to set the conditions for learning for all of our students in the Commonwealth and support you in your role as education leaders. And with that said, high-quality communications is vital. We know that in times like these, we would feel more secure receiving information quickly. At several points over the past week, it was not possible to communicate with both accuracy and speed, and in those cases, we prioritized accuracy. We will continue to do so as we learn and work through this together. The novel virus is just that, novel. It's a public health and now education imperative without precedent. Like our colleagues across the nation and world, we are learning and working in context that evolves by the hour. The most important thing we can do as an education community is to keep communicating and to keep getting better at exactly that, communication. And finally, We'll answer frequently asked questions. To be clear on many of these questions, our responses are initial and high level. In these cases, we'll outline the steps we're taking to reach more definitive answers. With that as an introduction to this morning's webinar, I'll now turn to my colleague, Andy Pickett from the Department of Health. Andy?
Thank you, Mr. Secretary, and thank you all. My name is Andy Pickett, and I'm the Director of Emergency Preparedness and Response at the Pennsylvania Department of Health. And I'll be speaking this morning about the broader public health response to the current novel coronavirus outbreak. Federal and state public health agencies were first made aware of an outbreak in Wuhan City, China in mid-December 2019. Since that time, the incident has grown exponentially around the world, with over 135,000 cases of the disease, now known as COVID-19, and nearly 5,000 deaths globally. These cases were originally centered in the Hubei province of China, but there are now cases in over 115 countries, and large case counts in South Korea, Japan, Iran, Italy, and other European countries. With the expanding situation in Pennsylvania, our department's incident management structure was activated on January 27th, and we've had great collaboration from our public health partners, including our Bureaus of Epidemiology, Emergency Preparedness and Response, our Bureau of Community Health Systems, and our Bureau of Laboratories. On Friday, January 31st, the federal government and the Department of Health and Human Services took some major steps that have influenced our response posture. They declared a national public health emergency and instituted the first travel restrictions. With these federal changes, we again took steps within the Department of Health and activated our operations center and have been working in daily operations since that time. Our primary objectives over the last 7 weeks of this response have included several buckets of operations. We continue to work on drafting guidance documents and fact sheets for various stakeholder groups, including documents developed in partnership with the Pennsylvania Department of Education. We also work with our regional healthcare emergency preparedness coalitions to engage the healthcare delivery sector. We've been updating our pandemic influenza plans and making sure that we are on paper ready for COVID-19. We're utilizing our operations center to coordinate public messaging and information, again with our stakeholders, including the Department of Education. And we have operated our command center as a coordinating public health entity with our state public health agencies as well as our 10 county and municipal public health departments who do this work at a local level. Over the first 6 weeks of response, our public health posture has been one of containment, where we are taking a more surgical and precise approach to controlling the spread of disease in the community. For travelers, this includes receiving traveler information and closely monitoring them according to a risk group, high, medium, low, or no risk. Verbal or written quarantine has been initiated for travelers in these high-risk categories. Medium-risk category individuals have been provided with verbal or written quarantine or self-monitoring, depending on the public health jurisdiction. Individuals who are quarantined or monitored for the 14-day period are quarantined or monitored for the 14-day period after leaving these impacted countries. Should symptoms develop, these travelers are asked to reach out to public health to assess their symptoms and allow us to coordinate testing in a safe and efficient way. Now that we have this limited introduction of cases into Pennsylvania, we're still using this core public health strategy of containment. This involves testing individuals who have a credible threat of contracting COVID-19, and for those cases that are positive or presumptively positive, we implement further public health measures, including isolating the sick individual either in their home, if they're only mildly ill, as are many of our cases, or in a healthcare facility. A public health investigation then takes place to identify close contacts of the individual with COVID-19. These individuals who may have been exposed are then issued quarantine notices and being instructed to stay home and monitor themselves for symptoms for that period of 14 days. This ensures that if they have contracted the virus, they are not as likely to expose others. I must note that while these contacts of a confirmed case are being quarantined, there is significantly less risk to contacts of contacts, and that these individuals generally should not be excluded from work or school unless there are other underlying concerns. While we work to implement this more surgical approach of containment, we're also beginning to see the need to work toward a broader public health strategy of mitigation. Public health mitigation in this context includes activities such as social distancing and avoiding congregate settings for a period of time. The announcement yesterday by Governor Wolf and Secretary Levine announcing certain measures to be taken in Montgomery County are good examples of these kinds of mitigation efforts. The closure of schools and other places where individuals gather helps to ensure that sick individuals are coming into contact with the fewest number of healthy individuals possible, again, with the overall goal being to slow the spread of the disease as effectively as possible. And finally, I'd like to talk just a little bit about the disease itself and why public health has this concern. We're still learning about the disease severity, but it does appear to be more severe than our typical influenza season, but certainly less severe than, for example, the 1918 Spanish flu pandemic. The disease is presenting more often in adults and elderly, with relatively few cases currently identified among children. We know that this virus is related to the SARS virus, and many of our assumptions about COVID-19 are based on this connection. We believe that symptoms appear 2 to 14 days after exposure, and we don't know how long individuals affected by the virus shed the virus, but it may be for several weeks. Severity is often mild, with barely any symptoms, but less commonly there are severe illnesses and occasional deaths. The disease is spread similar to the flu or cold. This means through the air by coughing or sneezing, close personal touching, such as handshakes, and touching objects that has the virus on it. There is no vaccine currently available, although this is being worked on, and is expected to take 12 to 18 months before it becomes available. Prevention for COVID-19 is similar to any other respiratory virus. Cover coughs or sneezes with your elbow. Don't use your hands. Wash your hands often with soap and water, or use an alcohol-based sanitizer when soap and water are not available. Clean surfaces frequently, especially high-touch surfaces like light switches, doorknobs, handles, countertops, and cell phones, keyboards, and remotes. And most importantly, and I cannot emphasize this enough, stay home if you are sick. Staying home when you're sick and staying out of school and the workplace is the single most important way to stop the spread of any disease that has person-to-person spread. So at this point, I'd like to turn things over to Deputy Director Tim Sevenson of the Pennsylvania Emergency Management Agency.
Thank you, Andy. And good morning. As Andy mentioned, my name's Tim Sevenson. I'm the Deputy Director of the Pennsylvania Emergency Management Agency for Response, as well as the Incident Manager of the Commonwealth Response Coordination Center. PEMA's primary role in this crisis is coordinating the collective efforts of the Commonwealth state agencies in support of our counties, municipalities, and our citizens. In addition, we are actively supporting our lead state agency, the Pennsylvania Department of Health, in their efforts to contain and mitigate the spread of coronavirus. We also work in cooperation and collaboration with other major partners of state government, such as the Pennsylvania Department of Education. The Commonwealth Response and Coordination Center is fully activated for this crisis. This allows us to bring to bear the full measure of the capabilities of state government in order to respond to this crisis. As Secretary Rivera had mentioned, our primary role is to collaborate with other state agencies, coordinate an effective response, and communicate with our constituencies. Communication being exceptionally important in this type of an event. Pennsylvania's leaders are focused on the health and safety of all of our citizens, including the impacted faculty, students, families, and other staff. PEMA has been in contact with our county and local emergency management partners over the past few weeks to ensure that they have access to the information, planning support, and anything else that they may need to deal effectively with the challenges of the COVID-19 and the effects that the COVID-19 may cause to our communities. We encourage our schools to work closely with their county and municipal emergency management and public health partners. These are the people that are most suited to assist with your planning efforts, including pandemic and continuity of operations planning. With that being said, PEMA does have a Safe Schools program. This program can provide templates and can provide checklists and other types of assistance with regards to a planning tool that we can offer. And I'll provide the URL to have access to that planning toolkit to the Secretary of Education for inclusion in this program. Working closely with the Department of Education and the Department of Health to minimize the impacts to schools and families, as well as some of the cascading impacts that will result from school closures, are our primary focus at this time. I'd now like to turn things back to Secretary Rivera for closing remarks. Thank you.
Okay, this morning's webinar is our third communication with the field. Since coronavirus COVID-19 emerged as a domestic public health threat, I want to begin by taking a moment to show you where these communications, along with other resources, including a recording of this very session, are located. Visit education.pa.gov and select the coronavirus information page highlighted at the top of the website. From there, you'll find links to messages from me, as well as links to education-specific information on the PA Department of Health's website and on the CDC website. Next, we'll walk through updates in 3 key areas. First, intergovernmental planning. Second, technical assistance. And third, policy and planning. So let's kick off with intergovernmental planning. We're fortunate to be part of an administration that not only values interagency cooperation and coordination, but practices it. Since the beginning of Governor Wolf's term, and most recently under his emergency declaration, Governor Wolf has set an expectation for all state agencies to be working together to ensure a system of government that works. We know it's the foundation that has allowed us to prepare a coordinated and systemic response to the current worldwide pandemic. As of this week, our internal response team has set up a shop in the PEMA Command Center, along with our colleagues from the Department of Health, Department of Human Services, and many other agencies. Like you, we're sharing resources, brainstorming ways to navigate uncharted waters, and collaborating on strategies to support you in the field. My hope is that you have experienced the same level of support from your local emergency management partners as we have received from our state-level counterparts. Their facility is extremely nice, and we've been treated well. So I want to take a moment to thank them for all that they've done in support of PD and other agencies, and to let them know that we're actually consider moving our offices over there full time. I'm hopeful, and I know that based on just a few conversations I've had with some of you, that this is not an isolated experience at the state level, but rather a model and expectation for LEA engagement with these same agencies at the local level. So now, technical assistance for the field, for our colleagues in the field. To begin with a piece of housekeeping, PDE created a dedicated resource account for coronavirus COVID-19 related inquiries. Our dedicated account is RA/EDE emergency response at pa.gov. RA ed emergency response at pa.gov, as you see on the screen. All communications that flow through this account are logged, routed for action, and followed up on within 1 week. At the same time, we want to create a more formal communication network to ensure that education community leadership are able to consistently secure timely responses to more routine questions and elevate questions with a nexus to a specific region. For example, if we need to isolate and engage in questions by county or intermediate unit. To this end, we are partnering with the Pennsylvania Association of Intermediate Units to initiate a communication funnel that will allow superintendents and other chief school administrators to email a single local point of contact who will then triage inquiries for further handling by IU staff, PDE staff, or senior members of my team. The intermediate units are going to serve as an extremely important role in ensuring the coordination of information both to the department and from the department to the field. So here I do want to ask for support of educational leadership in managing the flow of parent inquiries into PDE. As many of you know, hopefully by now all of you know, I read my own email, and the same holds true for my team. So we of course want to hear from our stakeholders, and we know that the level of concern is high. Still, we want to be more efficiently in our communications and effectively if we focus on our limited capacity on being available and responsive to you, the education community leadership. Therefore, we want to start by giving you the tools that you need to communicate locally with parents, community members, families, and stakeholders. As we look at policy and planning, following the governor's declaration, we have examined our existing state mandate relief authority. We have taken steps that will make it more efficient for local education agencies to avail themselves of this relief when circumstances and context warrant. And we are working in close partnership with the General Assembly to explore permanent legislative relief from mandates where appropriate. As we work on federal mandates, we are going to continue to monitor guidance and request relief from mandates that may impede your ability to respond to this event comprehensively. This is especially true in cases where impacts create or exasperate inequity. And while, as I'm sure you're reading and following up on, federal guidance is still emerging, here's what we can absolutely say with confidence. As leaders, we have the responsibility educationally, legally, and morally to ensure that our most vulnerable students are appropriately served. And we're working closely with our federal membership organizations, the U.S. Department of Education contacts, to develop a comprehensive FAQ document to share. But for now, please, ensure that your LEA's instructional continuity plans reflect considerations for ensuring equal access to educational opportunities, including the provisions of FAPE. Upon further review of the USDE OSEP guidance, PDE in collaboration with our IUs and patents will develop supports and resources for LEAs to meet those described expectations. And relative to federal accountability, thanks to the support of so many of you, Pennsylvania has enjoyed a coherent and smooth transition to the ESSA plan, or our Every Student Succeeds Act plan. Our state plan provides us important flexibility, and there is no instance in which high-stakes accountability decisions rest on anything less than multiple years of data derived from multiple measures and resources. So again, we hope that USDE guidance, including examples of how Secretary DeVos might use her own waiver authority, will be available soon. But for now, know that we will continue to advocate for all appropriate relief that honors the civil rights intent of the ESEA and ESSA. And know that we will work closely to evaluate flexibility that may be forthcoming from USDE to implement targeted relief from the 95% assessment participation rate requirement under ESSA. Know that we are prepared to request ESSA waivers related to accountability if there are large-scale testing challenges raise concerns about the validity of those results. And discussions around continuity of instruction protections for students with disabilities, including the provisions of FAPE and standardized tests at a moment when things are anything but standards, will continue to be at the forefront and foremost on our minds. And that we know you've been grappling with those decisions over the past week. So whether you choose to close your school in response to coronavirus COVID-19, or you choose to remain open, know that we will continue to focus on providing mandate waiver and support both at the state and federal level for each and every one of our LEAs across the Commonwealth. And we know that school closures have already begun in certain corners of the state. With all schools closed in one of our 67 counties, Montgomery County. Before I go further, I want to say that the decisions that I and members of my team have had with so many of you over the past few weeks are reminders of why we do this work. Every discussion, every consideration has come back to the needs of our kids. How to offer them all predictability and stability we can, and how to balance coronavirus, COVID-19 concerns with the concerns, both tangible and intangible, that result from school closures at any scale, let alone the scale that we're seeing across the country. Throughout, Governor Wolf's direction has been clear. We will make the best decisions around health, safety, and welfare of all Pennsylvanians when the state's top health, safety, and other experts sit at the same table and apply their professional judgment in the context of data, medical science, and Pennsylvania's unique context. As of today, the administration has implemented social distancing and ordered school closings in Montgomery County. And we are working especially closely with education partners in other parts of the Southeast to elevate the collateral impacts of this decision. For the rest of the Commonwealth, our guidance today is to mirror our state-level approach. Initiate or maintain communication with local health and emergency services agencies. Establish standards that you will use to gauge whether a building or LEA level closure is warranted. And identify other interim steps that support mitigation without carrying the more significant impact of school closure. And we'll touch base on these in a moment. If consultation with your local health and emergency partners leads you to a judgment that closure is appropriate, I will support that decision. So now we're going to take a few minutes to answer some of our frequently asked questions. So we're going to take a moment and situate additional aspects of PD's planning in the form of frequently asked questions from the field. As I mentioned at the top, some questions come with clear-cut answers. In other areas, we can't be as definitive, but we'll pair our initial answers with next steps where possible and try our best to give you a timeline for action. So a question that has been coming up often from our colleagues in the field: what steps can my school community do short of closure to mitigate the spread of coronavirus or COVID-19? Right, first and foremost, we think it's important that everyone take the time to evaluate local policies concerning your board operations. On March 11th, the administration provided notice to agencies on planning for large meetings, conferences, training, and community events. As a former superintendent, I recognize that districts are in the thick of budget planning now, but it's also the fact that a significant percentage of Pennsylvania school directors fall in a higher risk population. Please evaluate whether meetings can be postponed or whether individual members, including members of high-risk populations, can participate remotely. I want to thank PSBA for their leadership in the school director training space and look forward to them to supporting sound board policy development on this front. And if you're in need of specific policy language, please reach out to your PSBA representative as a support to review your existing policies or make recommendations for future policies. Now, as we look at postpone or canceling athletic and extracurricular activities, we are requesting that LEAs consider canceling large-scale events and postponing large-scale events, especially those travel including field trips. We've received some questions around curtailing of staff population participation in conferences. PD and many of our state-level partners have made difficult decisions over the past few days to cancel conferences and other events. These decisions prioritize public health and safety and ensure that educators are available to their home communities. We'd encourage you to adopt the same approach if you haven't already. We also think it's important to engage with our labor partners. I've been on both sides of the negotiating table. I've been a manager and a labor representative. My experience is that challenges like the one we're facing now bring out the best in people and provide opportunities to think and act creatively. So I implore and I engage you to work with your local labor partners to explore short-term strategies that maximize the health and safety of all employees and the students they serve. So what if schools close? What relief will PD provide from the 180 instructional day requirement in Section 1501? So under the current form that allows LEAs to seek alternatives for satisfying the 180-day instructional day per school year requirement, there are a number of options we have. The options are approving by a majority vote of the governing board of the school entity a school year with a minimum of 900 hours of instruction at the elementary level and 990 hours of instruction at the secondary level in lieu of the 180 instructional days. And approving by majority vote of the governing board of the school entity the scheduling of additional instructional days on Saturdays, not more than one per month, to complete the 180 instructional days or 990 hours of instruction at the elementary level and 990 hours of instruction at the secondary level. We're going to provide an updated form on PD's website to apply for waivers as you need them at your local level. We know that there are a number of mitigated circumstances that would require individual conversation and engagement. In many cases, we may have to expedite approvals that for specifically impacted communities, such as Montgomery County and other jurisdictions that may be especially proximate to those mitigated strategies. Again, we know what the law provides, and we know the flexibility that PDE has to address the 180 days or 990 hours of instruction, and conversations that we've had with both the governor and the General Assembly. So what we are going to do as an agency is make communication available to you through an expedited form or format, in working with your intermediate units and individually as needed, to find ways to ensure that you don't find yourself in a position by which you would lose funding or be held liable for actions taken by the state or for local circumstances. So again, we will continue to work with each and every one of you to find a waiver or mandate relief in the number of days students are required to participate. A great question, especially today, that has been coming up across the field. What protections are available to LEAs concerning staffing impacts? And we know through conversation on a normal day, your decisions concerning staffing are tied to federal reporting requirements. Our state policies concerning certification, assignments, and in other cases, staff to student ratio, and local collective bargaining agreements. Starting local, we ask you to examine and revisit policies and practices to prioritize employee health. At the state level, we're adding capacity to speed the processing of emergency permits and are examining options for targeted relief of state-level policies in impacted communities. In terms of federal requirements related to equitable access to effective educators, we will continue to monitor guidance and examine options for how we treat the school year 2019-2020 reporting. Again, depending on how we continue to respond to the current conditions, we will make recommendations both at the state and federal level to ensure you're not held accountable for circumstances beyond your control. Another question that has been coming through: what can LEAs do to ensure continuity of school nutrition program? As we've shared with many of you, PDE has sought and received USDA relief to allow non-congregate meal service during school closures associated with coronavirus or COVID-19. Under these waivers, school meals must be a complete unitized meal that includes milk. However, you can think outside the box in working with your school community to find ways to feed and provide nutrition and nourishment, especially in some of our most vulnerable communities. So what we're trying to do in this case is provide conditions that local leaders can come together and find ways to provide feeding opportunities to our students, their families, and community members across your district. Another question we have is: how can we plan effectively for administration of state assessments? As of last evening, USDA is not relaxing statewide assessment requirements, and any flexibility is described in terms of individual schools facing extraordinary circumstances. Flexibility around the 95% student participation rate requirement is possible, along with some relaxing of accountability decision that involves data from this school year and impacted schools. We're going to continue to monitor the federal position extremely closely. We're going to communicate that information to you throughout the field, and even if we need to communicate that information as quickly as possible, we will utilize our intermediate unit partners and the partners within our professional organizations. But know that we are going to be advocating to provide as much relief to school districts impacted by COVID-19 or the coronavirus. So again, as we opened up this one mass communication, we thought it was important that we work together and assure you that we are monitoring the information closely. We are monitoring conditions closely. We're going to continue to provide guidance as often as possible, and we will seek waivers to request relief should the need arise, or as I should say now, as the need arises. So to close, I want to thank you for your leadership, your calm, and your professionalism during an incredibly trying time. More than anything, stay connected to emerging communications from the Commonwealth. The situation is evolving quickly, and we want you to make the best decisions you can based on the best information possible. Finally, while the governor has issued specific guidance concerning Montgomery County, there will be very significant residual impacts in neighboring communities. These already have been widely reported over the past 12 hours. So use today to prepare any additional communications to parents and families and to plan for staffing impacts that will certainly grow in both complexity and scale. To be clear, traveling for work is considered non-essential travel. This has been our own approach with our Commonwealth employees. The ability to provide a safe learning environment means adequate staffing levels. Staffing levels should be central in your planning around any closure, and I trust your judgment in this area as we work to implement both the substance and the spirit of Governor Wolf's directives. Again, thank you for all that you do on behalf of our students and communities. You're in our thoughts. Please be safe.